What is the number one question when it comes to CBD or cannabidiol? Is it safe? And this is where I'm going to talk about a war of words between the WHO and the FDA. The WHO, or World Health Organization, says CBD is safe. It's well tolerated. In its statement in June of 2018, the WHO says CBD has no public health concerns, that it is not concerned about any addictive or abusive potential. And the only caution it mentions is possible drug interactions with medications one may be taking. What does the FDA say? The FDA says just the opposite. In fact, in this country, we have only one drug approved by the FDA, Epidiolex, approved in 2018, which is used for rare form of juvenile seizures. Interestingly, when it comes to side effects from CBD, it's usually minor and mild, maybe dry mouth, dehydration, rarely lowering your blood pressure. But with Epidiolex, that medication approved by FDA, it may have more serious side effects because of its content, including alcohol and artificial sweetener. So here's the problem. Our country spends more money on healthcare than any other country in the world. We spend more money on prescription drugs than any other country. At the same time, when you watch TV, you may see a very well-known actor coming on introducing the latest vodka, latest tequila. How about in Massachusetts? All I see is this new ad, many ads, in fact, about gambling, legal gambling. So here we can talk about alcohol, which after one drink, I cannot drive or operate any vehicles, or I probably should not be delivering babies either. Or gambling. What kind of problem do you have with gambling? Lots of problem. These are introduced, talked about, promoted in public forum. But when it comes to CBD, which the World Health Organization says is safe, well tolerated, and may be great options for many conditions, we can talk about it. I can't even run ads. What's the problem here? Particularly in women's health, I want to talk about postpartum depression. Postpartum depression and anxiety may affect at least 10 to 20% of American women annually. We know that the majority of women after delivery may experience postpartum blues, and this may be 70 to 80%, but the estimate is 10 to 20% of postpartum patients may actually experience clinically defined depression and anxiety. So we live in a country with almost 4 million births a year, 10 to 20%. It's possible almost 1 million of you are suffering from postpartum depression and anxiety for days, weeks, and months. What kind of solutions do you have? Not much. Therapists, there aren't enough. Certainly not enough who takes insurance. Psychiatrists, same thing. Drugs, let's talk about drugs. SSRI, which is probably the most commonly used drug for postpartum depression, or depression and anxiety for that matter, for the past half century. Is that the choice for many of you? I'm not so sure. First of all, this medication, or this class of medication, takes good 2 to 4 weeks. You are often told if you don't see any benefit in 6 to 8 weeks, call your doctor. Really? Have you tried to call your doctor and make an appointment? How hard that is for follow-up? What about side effects? Notorious side effects. We're talking about from increased anxiety, ironically, blurred vision, dizziness. It can also, some medications can cause abnormal EKG findings. GI side effects like nausea, vomiting, diarrhea. How about weight gain? Like with Zoloft, which increases appetite, particularly carbs, and affects sexual function. It can cause erectile dysfunction for men. So we're talking about a class of medications which may or may not work, takes minimum of 2 to 4 weeks with lots of side effects. How can they be the only option for so many of you? Well, I talk about what is wrong with healthcare in this country. What is wrong with healthcare in this country for women when we have so much resource? One of them is this problem, overprescribed medications. So, for many of you suffering from postpartum depression and anxiety, you speak with your doctor. Oh, by the way, I forgot to tell you. May I remind you, most of you are not going to see your doctor for first 6 weeks, even if you had a C-section. Why? Because postpartum visits don't get paid. So, 6 weeks after your vaginal delivery or C-section, you're talking about, oh, I'm really depressed. You think that visit is going to go well? You think you're going to be given half an hour to talk about all of your issues? Maybe some of you will get lucky and maybe will be offered, oh, well, Mary Jane, looks like you may need medication for postpartum depression. I'm going to prescribe this. Let's see if it works. And let's see you again in 6 weeks. Is it the best we could do? On the other hand, I think great option may be CBD. If a patient is suffering from postpartum depression and anxiety, why not CBD? It's considered safe and have been reported to be very effective with anxiety, depression, among others. You start, and if you're working with the right company, right provider, you should be able to reconnect with that company or provider, perhaps in 7 to 10 days, to see if it's working, to see if it needs additional fine tune-up, and no significant side effects. And you know what? You don't need to speak with a doctor. Therefore, no prescription is needed. You don't need to deal with the insurance company. If you are in need of something, I think this may be it. And why am I talking about this? Because I'm frustrated. After working 30-some years with you, after 200-some thousand visits with you, talking about this and among others, my hands are tied. I talk about, when it comes to mental conditions, it works really, if one has the luxury of having a therapist and medication and frequent visits, that probably is the best option. But for many of you, that isn't the case. And if I talk about medication like Zoloft, for example, if you're my patient, I always say, let's see what happens in the first 2 weeks to see if you have any side effects. And let's see what happens during 3rd and 4th week to see if you get any benefit from the medication. If not, we may have to change. That's a month with potential side effects. Or maybe consider CBD. Many of these medications I had mentioned in the class of SSRI, if you look in for the lactation, often this is what you hear. Weigh benefits and risks. Inconclusive data based on human research. They're not really helping you, right? And it'll say, consult your doctor. Well, many of us really don't know what to tell you. Consult your doctor? Now, if you find that you are interested in CBD, many of the products also say, oh, if you're pregnant or breastfeeding, consult your physician. Guess what? Many physicians, many of us are not comfortable with the CBD. Having studied this topic, I think CBD is a great alternative for many of you. Whether you are breastfeeding or not, whether you're pregnant or not, I think we have to find ways to provide alternatives to you rather than saying, well, not enough data. FDA has not approved. Okay, let's really think about what FDA says. As I mentioned, our FDA says when it comes to breastfeeding and pregnant mothers, CBD should not be used because of inadequate data. And they mention many other things, including how in animal studies, CBD has affected sperm production, testosterone level, and sexual functions of male mice. And they mentioned this using one paper published in 1986. So I'm thinking, okay, they are wanting us to really be careful. Maybe for men, because we're talking about male animals, mice, and the FDA is really trying to tell us to be cautious. And the only source they can use is a paper that published 40 years ago. One paper. Is that what happens with other recommendations? I don't know. So at some point, I think you have to really take a leap of faith. And you know what? We do that every day. We get into our car. There are over 1 million car accidents a year. How many people die in car accident? But we don't think about, oh, gee, could this be my last drive? I better really hug my wife or my kids really tightly because I may not come back after car accident. We don't do that, right? I mean, we drink alcohol. We gamble. We go to many restaurants. We order food made by people God knows who, and we don't even know where the raw materials are from. The point is we do this every day. At some point, rather than suffering, I think if there's a reasonably safe alternative that many Americans and others are using, maybe that's an option you should think about. It's not going to make you be addicted. It's not going to make you abuse CBD. Have you heard of any gun shooting because someone took too much CBD? Have you read about anyone getting into a car accident because of CBD overdose? Answer is no, because it doesn't happen. So, we live in time where we have so much information and we are struggling to really filter and figure out what's right for you and what isn't right for you. And maybe I'll be the first board certified physician with 30-some years of experience and 200-some thousand patient encounters who's telling you, I think CBD may be a great alternative for many of you. You know what happens if you don't sleep well? Well, if Mary Jane, who slept well all her life, all of a sudden doesn't sleep for a week, her glucose metabolism gets affected so that after 1 week, her sugar control will be like pre-diabetic. Imagine if you're not sleeping well because of too much anxious thoughts. Would you rather not get some sleep? I think whether it's insomnia, anxiety, or others, you should really look into CBD to see if it's a right alternative for you.